introductions of who is here. So start with you.
Okay, Dave Wyndham, I'm the Director of Mason County Community Services.
Terry Jeffries, Mason County Commissioner.
Kathy McDowell, City Commissioner.
Diana Yu, Health Officer.
Oh, Debbie Riley, Environmental Health Manager for Mason County Community Services.
Jeannie Raywald, Executive Director, Mason Meadows.
Brianna Loper, I'm a reporter with the Mason County Journal.
Ben Johnson, Mason County Public Health Educator, Substance Abuse Coalition Coordinator.
And
Julie Amador, Clerk of Board.
okay, thank you. And we're going to skip the approval of the agenda and the minutes. And
What we'd like to do is, Dr. Yu has an appointment she has to get to, so if you wanted to move forward in the
Yeah.
agenda.
Actually, the thing is, I think Randy wanted to hear about this as well, but maybe he can read it from the minutes.
or he can watch it on the web.
Which he does.
Alright, just sharing that. So the thing that the issue that I wanted to talk about is that we have made a lot of the arrangements and discussions about getting our community forum together on opiate abuse. What did we finally decide on the name of the?
Yeah, I thought it's the substance abuse, or no, the opiate community forum, something similar to that. And I don't have the paperwork in front of me.
Yeah, I apologize because I had the piece of paper in front of me and somehow I didn't pick it up. But we have sent out save the dates information to a lot of people. And what this is a general overview of the opiate, what's called the state opiate response plan. And we are using this as a template for our discussion during the forum. So the forum will be, will open up with a presentation by either Dr. Caleb Banta-Green, who is the director of the Alcohol and Drug Abuse Institute at the University of Washington, and Molly Carney, who is the, her official title, she's one of the directors of the Evergreen Treatment Services up in Seattle. So they're going to do a tag team, or if one of them can't make it, we have them both confirmed, but just in case, either one of them can actually cover the topics for each other. The first part of it is just setting a baseline on here's narcotics, here's narcotic abuse, this is why we need to talk about this issue. And then the second part is to talk about the different treatment options that are available. Then we will be opening up the forum to having different parts of our community actually speak up about what is currently already in place in Mason County along each different goal. So the goals are preventing opiate misuse and abuse. The second goal is to be able to have treatment options for people who have opioid dependence. The third goal is preventing death from overdose. And the fourth goal is to actually have proper use of data and information and sharing that so that we can plan better for the future and evaluate. So these 4 different goals are the same goals that the state work plan has put together. So we decided not to reinvent the wheel and follow the goals and have us all, the entire group of all the people that attend the community forum should be able to, no matter where they're coming from and where they are in the spectrum of how they feel about opiate abuse and treatment and whatever, they should be able to find a place in the whole continuum of things that need to be done to move our community forward on this issue of opiate abuse. So somebody that is against treatment against naloxone, against methadone, can still work on the prevention aspect of this work plan. Somebody that, you know, wants to really focus on making preventing overdose deaths by trying to have naloxone or this rescue drug available in the community, can focus on that. This is going to be, it's not the end. The plan is for this community forum to be kind of the kickoff to where our community wants to go on this issue of, in particular, not just all drugs, but in particular opiates. And I know that there's been a lot of interest among different groups within the community, the Criminal Justice Work Group for one, and, you know, members of our community. There have been forums that have been going on in the community about this. We've brought it up and we've discussed it at Board of Health a number of times. But getting everybody on the same page in the same room and actually working on a plan. So the master plan for this is actually under the umbrella of Moving Mason Forward. Because under Moving Mason Forward, we do have one of our goals is substance abuse and mental health. That's one of the issues that we have prioritized as something that we want to work on. So this would fall in under that umbrella.
Is that one of the 7?
Yes.
Is it called?
It's called
It's
behavioral
behavioral
health. It's substance abuse
Okay.
and mental health.
I was,
Preventing substance.
Yeah.
Chief Moody came into the commission meeting yesterday. They're training their police officers today. They got a grant for that. So
Yes.
they're, by this afternoon, tomorrow morning, they'll be ready to go.
We met with Chief Moody. We met with a number of different individuals within the county to kind of talk about where they're at, what they're doing. And, you know, also one of the things about highlighting this in a community forum is making sure that people come and they hear what's going on. And part of the plan after this forum is to actually have all of this information put together and put under Inside Vision, so that different groups may end up choosing to work on different pieces. And we will have then a place for them to submit information so that somebody else coming along and say, hey, you know, I'm interested, you know, my brother just had a near-death experience. He had an overdose, and I really want to work on this issue. How can I connect up with folks who are working on this issue? We can plug them in that way. So Chief Moody, we talked with Chief Moody about what his plans were. We also have are working with the Department of Health on getting be part of a grant that they're receiving, which would help augment what Chief Moody is doing, because what their plan is to actually deliver the medication to prevent the overdose. But what they don't have in place is somebody to do the follow-up, working with the person who overdosed or who near overdosed, to get them to receive treatment and to seek other treatment services, other
Well, we do.
services. Huh?
We do. We have 2 contracts for intensive case management services.
That's in the jail.
Yeah.
No.
We do have them. We have contracts with Northwest
Northwest
Resources to
Resources.
do treating the vulnerable, intensive case
Right.
management is for vulnerable adults.
So what this is part of this is when the chief does, unless he is connected with Northwest Resources.
That's a good question.
So
Yeah, there's a
so-
process.
So there's a process piece that's
There's a
kind of that disconnects, and we've talked to him about that, actually. It's as though, so once they identify, when we actually have this set in place in other communities, what's happened is they've made overdose reportable. So that when somebody has.
Who's they?
The
Reportable to
public
who?
health. Public health. Makes it
So-
reportable. So just like a disease, if you've got gonorrhea, you are required to report it. If you as a physician or law enforcement comes across somebody that you rescue, EMS rescues somebody using naloxone, we can actually, by law, make it reportable. They have to report to public health, and what happens is public health then helps to make that connection, make sure that they know where to go to get Northwest Resources. Because when you have more of these naloxone programs available, there have been, and I can't say that it's going to happen every day, but up to a certain point, we may need more. I don't know how many clients.
So the missing piece is that the officers yet don't have the connection to connect people unless there's been a law broken and they're taken into courts. So there's just a few pieces that still need to be put together. So the resource is there for them to get treatment.
So the
That's
police
correct.
officers carry this with them,
Mhm.
and if there's an overdose, they administer it. Then there isn't a connection from that point to another point of that person? Or do they report it and then,
Right now, I have to find out exactly what Chief Moody plans to do. What we had said at this point is if they use naloxone, they actually report to him, Ben, down
okay,
there.
part of their report, a lot. How do you spell that?
Naloxone,
Okay,
or the trade name is Narcan.
okay, all right.
So they're training to use it. Sometimes you need it more than once because, you give them the rescue and it only lasts a few minutes. And if they've actually taken a huge amount of opiates, the symptoms may come back. So, in general, they will give them the rescue and then probably call EMS.
Mhm.
Just
So
to
we
make
need
sure that there's
that we
follow-up.
can get, it's not clear to me, this sounds like a very, a loose group of folks that are working on this. So, just a group of people that decided to get together, is that what this is?
Which one are you referring to?
This?
The opiate forum?
No,
Or which you're
this,
talking
this,
about?
whose goals they are, how we're gonna operationalize them, how we're gonna make them happen.
That's what we're doing at
That's
the
what's
forum.
going to happen at the forum.
And can you say the date of the forum? I did get the
The
information.
forum is September 21st.
Yeah.
Where will that be?
At the high school.
Sheldon High
Shelton High
School.
School.
That an, that's an evening, that would be an evening,
No, it's
right?
going to be after, it's going to be.
4 to 7.
4 to 7.
What day is that?
It's a Wednesday.
Okay.
But, I mean, to,
Go ahead.
I'm hoping that everybody's aware of what we do have coming down the pike as available resources and what is currently here for available resources. I don't want to reinvent
That's
the
part of
wheel.
what's going
No,
to be
that's
talked
part of-
about in the
But what I'm
forum.
saying is if I'm not going to be at the forum, or if somebody can't bring that
We
information to the
we
forum.
have
Northwest Resources
we
charge
have
of
made
this.
sure, we are, well, that's what we're going to ask. We're
Our
asking,
Department of Community Services is. this is-
we're asking the Board of Health. That was part of what the, she's
Oh,
going to
okay,
talk
okay.
about. We're
Okay, I didn't
asking the
get to
Board
that
of
one.
Health
To
to do
This is
this.
what I heard, we don't have any place to go. Yes, we do.
No, it's not that we don't have any place to go. The thing is that the community doesn't know what is available.
Right.
Part of the community forum is making sure, so part of the people getting up to speak is Northwest Resources, talking about what they have available. Chief Moody talking about what he's doing. Prescription drug take back, talking about what they're doing. The schools, prevention, so the different pieces that are already in place. And then for the rest of the community to identify where they want to be involved or where they can offer up more to fit into the different goals. So we're using this as it's like a parking lot, because the goals are there, If you can think of others that we need to put in as a goal, we can do that. But if we're working on the issue of opioid use, misuse, preventing deaths, having these 4 goals, we're patterning it after what the state opioid working group has put out. So we're not going to reinvent it. We're using the exact same goals. What we want is to put this up on the big board in the sky that then says, here's what's happening under goal 1, here's what's happening already under goal 2, 3, and 4. You have things that you need to add, that you are aware of, that we're not aware of, because we don't know everything. I mean, we're, in working on this for the last 8 months, we've actually discovered more and more programs, things that are available. So we've actually gone out and, spent time with Dennis Neal and talked to him about what they're offering at Northwest Resources. And they have identified gaps, more gaps that isn't still yet available to our folks.
So, I see on this list here, so if someone is called, if the police department or the sheriff's department is called to a resident or someplace where a person is overdosed, and they administer this,
No.
yes, Narcan. Then what happens to that person that has overdosed? They're taken to an EMS is called, they're taken to the hospital, they evaluate it, and then they're sent somewhere, or they just released?
No, in general, a person gets a rescue and they have a choice. Many times they refuse to go anywhere. They'll go home. They'll
Okay.
go to sleep.
All right.
What we're talking about is, I can rescue you from your immediate narcotic overdose.
Mhm.
I can't make you go into treatment, but the opportunity for me to connect with you, to talk about treatment, and
Okay.
trying to get you into treatment. A lot of times, the overdose event
Mhm.
is one that scares them, and it might be a good opportunity to talk about treatment.
So do you
because-
come to me to the hospital? I'm recovering
No,
in
no,
the...
I don't do that.
I mean,
is
this
where
person,
we're
I'm saying this
connected.
person.
This is where we don't have a body. This is why the grant from the Department of Health is to provide a person to actually do this
A
connection.
trained person to make
Yes.
a connection.
Right now, what we're having, because in the interim, when Chief Moody decided to go and start this program, there's still that,
There's a disconnect.
there's a
there.
disconnect.
I see,
There's-
okay.
There's still that gap. And we're trying to Band-Aid that gap until there's a program set up. So Northwest Resources has intensive case management, but you have to get this person to agree to go there.
So I think this is part of what this is supposed to be about.
Yeah.
Yes.
It may
I
raise.
guess I worry that if not all the players are there, that you won't get. all
But
the
we have
information.
specifically invited people, matter of fact, we picked the date based on the speakers and the main players in our community that run these different organizations to
Will the
make
behavioral
sure.
health organization?
Yes.
Yes, yeah, we've already made sure that the main players could be there because we want them to be at discussion tables. We want the experts to be in the room to help guide and facilitate things. Yeah.
And maybe Lydia can share with you the invite list.
No, that's fine, I just want to make sure that if they're there, then that's good.
So now that we do
So-
have a, well, we do
The
have
request is that this community forum actually be sponsored by the Board of Health. Because I think it is a health issue within this community that would be, I mean, we've been working in the backgrounds and trying to make sure that we get all the ducks together. And I think, and clearly, I thought that there was going to be more discussion, briefing between you and Commissioner. No? Okay.
Okay, so if you want the Board of Health to support this, what does that actually mean for us?
It means your name listed on the flyer
Okay,
and be an awareness of it, and that you support
Support
it,
it.
basically. That you're supporting
And that
this,
it-
which we've had briefings and discussed wanting to do some things you asked. Well, in the last briefing we had, I had all three commercials ask me questions, and I said, we're going to be discussing, we're going to do that at the forum. Those are the exact things we're going to talk about at the forum. So maybe I misunderstood what kind of communication you wanted, but
Okay. I would make a motion that we, as a Board of Health, be a sponsor to the Community Forum on Opioid Addiction
There you go.
on July, September
All out.
21st.
so do I have a second?
I'll second it.
Okay, any further discussion?
Yeah, I have a follow-up discussion item on this very topic, so I just,
Do you want to do that now?
no, I'd rather vote first.
Okay, all those in favor?
Aye.
Aye.
Okay, so it passes.
So you made a phenomenal suggestion or a statement that would like to make the administration, I think of a naloxone, a reportable incident.
It's not a statement, it was an example of what is happening in other counties.
I would like to suggest that we as a Board of Health make that a policy recommendation to our Board of County Commissioners. If it's, I don't understand if that's something that the Board of Health can adopt as a code, or if it needs to go to the Board of Commissioners.
Yeah. It actually is under the Washington State notifiable conditions, which is something that the health officer can require. So we can make, actually I think it would be great if
The
the
recommendation.
board, the commission decides to go that route. We can certainly do that. And it may be better because it would then encompass people that we don't necessarily have control over with our notifiable condition rules. So I think that is a good idea. We can look at, so far what I know in a couple of different counties, it's been a health officer rule that they put into place as part of the notifiable conditions. But it does include law enforcement, fire, I think that's pretty much it. It's law enforcement and fire that they, and then the
Emergency
doctors,
rooms.
the health emergency rooms, yeah. Any medical, it would automatically, law enforcement and fire is not necessarily people that we have control over, but we can certainly make it notifiable by whoever we need to make it notifiable. But I think having the commission, the board actually make it a policy, I don't know exactly how we would do that.
Yeah, so Dr. Yu, what I would suggest is that you do some out, if you feel this is important,
Mhm.
that you make some outreach on that very issue with our sheriff and our chief of police, so that they understand the ramifications and can train their staff and deputies what that means. I think that your doctors are very familiar with
Yeah.
that process, but if law enforcement isn't.
Yeah, and actually, Chief Moody is working with Dr. Hoffman, who is the head of EMS, to do the training for their officers. And so this is all relatively new. It was actually something that Chief Moody had decided that he was going to do.
So is Dr. Hoffman also, so he has contact and/or supervision over all the EMS
Mhm.
providers of all the
Mhm.
fire
Oh,
districts?
yes,
So
yes.
this will trickle down to.
Yeah,
the
so he
smaller
is the medical director of our EMS program in Mason County. So in the past, he has been very reluctant to have law enforcement involved in giving naloxone. But he's changed his mind, apparently. I have not talked to him.
And have you already had these discussions with Sheriff Salisbury?
No, I have not, because this is something that Chief Moody decided he was going to do, which is really not I wish I had that persuasive power, but it wasn't something that I came up
No,
with.
he had said.
He had actually,
his
he had
intentions.
actually had the intention, he found out about it from another law enforcement official. And I think it's a good thing to actually try it in the city of Shelton first and see how that works and then bring in the rest of the county. I think it is important for our citizens to know that it is available. The experience in other counties is that once you start arming your law enforcement officers with the naloxone, that you do end up saving lives. But it's beyond just saving the life. It is trying to get them to take that next step. And so you're right, making sure that everything that we do is connected so that it may not run completely smoothly because there's sort of a handoff that needs to occur. And in the bottom line, central to all this is the individual's desire to get help.
So I just want to also piggyback on this topic with that Dr. Yu apparently has been working with some of the folks at the University of Washington. I was called by a student of the School of Public Health who was doing a survey regarding who are the more appropriate people to provide this naloxone in the community. So I think that information would be very informative on any public policy decision.
Right. They were working with us so there are actually a number of different pieces. They interviewed different people for different issues. I think they did interview Chief Salisbury also.
So I guess I have a motion on the floor still, the one that you made for us.
It was a
to-
suggestion and
Suggestion.
recommendation. I don't know if
Okay.
that needs action.
So should we have Dr. Yu do more research in it as to what would be the best way, or should we have her just,
This is what I would suggest.
okay.
I'm not the chair.
No, go ahead.
I would suggest that if our next meeting, if you would be willing to come back with some of the detail regarding what the codification is that makes this allowable, how it was implemented in other communities, and then that briefing then could be for discussion here about would there be some changes we would do, especially how other communities have done it, and then and then we can take that information, and if we move it forward to a Board of County Commissioners approval, we'll have all the
Right.
background
Actually, by the
documentation.
next meeting, we will have finished the form. We will have done the
Right.
form.
Right.
So I can bring, but it would probably be like 2 or 3 days after. So we might not have,
Right, but I think operationalizing something like this is probably not needing to have the form as much as what's already been done, what are the authorities that allow it.
so what I'm getting from you is a very much, very interested in finding out how we can implement naloxone in Mason County.
No, making the administration of it reportable.
Right.
Is it the administration of naloxone or a overdose? What's reportable?
So what's reportable is overdose.
Okay.
Making overdose, or near fatal overdose or whatever overdose reportable.
Okay, that's what I meant.
Okay, so I can certainly look at that and work with other colleagues. Skagit County has done the most work on this, and they've been distributing naloxone for a long time. Naloxone is available from your doctor. Your doctor can write a prescription for you. If you have a child or a family member that is an opiate user, they can write you a prescription. So individuals may have an overdose and not necessarily report it to anyone, and they just use their naloxone and they go and get it refilled.
Is it like an EpiPen?
It's an inhaler.
Inhaler.
You can do
You
it
can
by
do it
injection
or-
or by nasal spray.
And
Okay.
what's faster? What works faster?
The what? No, I just think that we need to move on.
Okay,
We
all
have a
right.
lot to go
Okay,
over today.
I'll ask questions later.
Go to the forum.
Yes.
I will.
So, since we've already started the agenda, I would like a motion to approve the agenda.
I make a motion to approve the agenda.
I'll second.
Okay, all those in favor?
Aye.
And the motion for the minutes?
I would recommend approving, or I would move to approve the May 24th, 2016 minutes with the revision of striking Eileen Granscom as being in attendance.
Any second?
Second.
Any further discussion? All those in favor?
Aye.
Aye.
So, now, we're down to, vaping.
So, vaping has become an issue statewide, nationwide, and in your packets I've included, we have some fairly in-depth information on vaping as far as the federal regulation and state regulation, and the state regulation actually came out first, and it was pushed as a result of some other health jurisdictions had moved ahead with county ordinances on their own. So Ben has got a short presentation that sums up what's in your packets, and we'll go through that quickly, and I'll kind of talk through the process as we go. So we have both the state and federal vaping regulations, and then in Washington, like I said, some health jurisdictions have their own. Indoor Clean Indoor Air Act ensures that all work indoor places are smoke-free. So this is the tobacco piece of the Indoor Clean Air Act. Does not necessarily apply to vaping because vaping is not an issue that. Secondhand vapor is more than just water. It's more than just the steam. You see people vaping. There's a lot of product out there, which concerns people. There's other substances in there. And you see the list there: tin, toluene, aluminum. One of the things that we're seeing is a high use in teens. Teens are looking at vaping as an acceptable alternative to cigarettes. So the use of vaping in schools has gone up dramatically. I know in some of the rural school districts, it's the #1 issue that they're dealing with. Yeah, if you would. Okay, so currently the Washington State ban that was passed, or the Washington State bill that was passed this last spring bans use of e-cigs and vape pens in schools where children may congregate, and sort of put some restrictions on who it can be sold to. It placed fees for licensing and fines on vaping establishments that violate those. It has some language in there about what can be within the product, but it doesn't really address in a great deal. Washington State bill does not address the content of what's sold. So it's in a very real sense unregulated in that.
So the age 18
Right.
is
So
new.
the age 18 is new. There was a move to make it 21. And then at the end of the negotiation on Senate Bill, what was it, the 6328, they decided to make it concurrent with what the cigarette regulations were, so there wouldn't be confusion. They would have one regulation, one age that would apply to both.
This was passed last legislative session.
Yes. So they went into effect on June 28th of this year. So the new federal regulations require that manufacturers submit their products to FDA for testing. Until this point, that hadn't been the case, and for approval before they're sold. Now, Clark County did, or I think they were the very first one that did an ordinance that prohibits the use of inhalant delivery systems wherever smoking is outlawed. So indoor smoking, and I think in their case it was parks, and some other public places as well. Snohomish Snohomish and King had probably the two most in-depth regulations, I think, regarding use of vaping, e-cigarettes, and they basically concluded it's the same as tobacco and applied all tobacco regulations to vaping as well. Thurston adopted a resolution about tobacco use and smoking policy, and essentially wrote it into their code that addressed smoking. As of January, this is Pierce County, and some of these that go beyond the state and federal regulation, they're looking at, they may have to repeal portions of their local county codes because they exceed what the state and the federal government allows. And that question is still out there. So we'll see how that works out in this next legislative session. So I don't know if they address it directly, but it may come up again. As will, I think, a move from 18 to 21 on both cigarettes and vaping products. I think that's probably going to happen again as well. Snohomish, countywide ban, parks, restaurants, other businesses. In our experience, we've not had complaints. We've not had people call Ben to complain about indoor air quality, especially in restaurants and bars, around vaping issues. So this really has not been a huge issue for us here in Mason County.
And in fact, I don't think I'm the only one that typically gets the complaints for the county. I haven't had a smoking complaint even probably for more than a year and a half.
So I think the culture around smoking has changed. I did a survey last summer in Stevens County at our biggest event in Stevens County. I took a clicker with me and I walked through the event counting smokers that I saw, and the most I saw in each walkthrough was 6. So the people smoking in public places, the culture I think is in the process of changing. Now, are people still smoking? Yes, they are. I think that you see a lot of maternal smoking. In some places, Ferry County, maternal smoking, women who smoke while they're pregnant, is as much as 35%. So smoking is still an issue. One of the things they're trying to address in this legislation is vaping, a gateway to cigarettes. And that's still a topic for discussion. There's just not a lot of studies out there yet that make a conclusive connection between the two. King County banned the use of electronic cigarettes. It's not a complete ban, but they essentially rolled it under the same regulation that they use for indoor air quality and their own county smoking ordinance. This is a little hard to read. What we're finding in the Healthy Use Survey and in BRFIS, which is the Behavioral Risk Factor Surveillance System, that's a mouthful every year. So is when they're doing these surveys, is they're finding that 10th graders especially are the most experimental, seems like, age group. Things trend up to 10th grade, and then by the time 12th grade comes along, they tend to trend back down a little bit. So it's a 10th graders are kind of our measuring stick as to how popular activities are. And vaping has become very popular with the 10th grade population. So we've seen a dramatic increase where cigarettes has not been the same level of increase. And that may be a lot. Okay. So the use of vaping has the slide says, has more than doubled. I think in some places it's even higher than that. You know, you get into the younger population, say the 18 to 30-year-old category, it's a much more popular, much more accepted activity. The dangers yet haven't been documented. So, as Ben and I talked about, go ahead, Ben.
The reason I use this data right here is because we don't have state data yet for our adults. The first time they worked on minors was in 2014 on the Healthy Use Survey. So we'll have a little bit more with minors in this next survey coming up in September, October. And hopefully in this next year we'll have adult information, but we don't have Washington State adult data yet. So my feeling is that, increased, I mean, just by what I see on the street and by what you see on the street, but we just don't know yet.
And part of that is because BRFIS does lag behind. So, and Healthy Use Survey lags behind. So what you're seeing come out in the data is really probably a couple of years old. And one of the other issues we have with BRFIS is that it's really landline driven, because a survey on BRFIS cell phones, we can do cell phones, but it costs 7 times as much to get the same amount of data from the cell phones as it does from landlines. It seems like people on landlines like to talk more than the folks on cell phones. So it's a more expensive process to get that data. But that's the direction we're heading, is because many people are getting rid of their landlines and going to strictly cell phones.
Definitely.
So the ability to gather this data has changed and become a little more difficult in the last several years. As Ben and I sat and talked about this, and we looked at what the state regulation is and what the federal regulation is and what the need is in Mason County, we felt pretty comfortable coming to the board with a recommendation that for the time being, we think that the regulations are good enough. I don't think we need to address things at a local level. First of all, it's difficult to enforce. Who would enforce it? You know, that's extra stress on law enforcement, and I just don't think it's necessary. But we wanted to bring it to the board and get board feedback on vaping and if we should move forward with anything.
I have a question. One of the issues that came up was the report from the Washington State Poison Control that the poisoning of the use, or the vaping products have like skyrocketed. And I'm wondering, and I know that they have the data by county, so we could ask if they've had.
Meaning somebody got poisoned by using it, or
Children.
Right, children actually, because the nicotine that they use for the vaping products come in a bottle, in a small bottle. It's not necessarily child cap, so
So drinking
Kids.
directly.
But
kids,
it currently is now because of this childproof tampering, or childproof labeling requirement at the fed level.
labeling, I don't know if
Or,
it's,
or-
is it,
There's a anti-tampering device that's supposed to be included as well, once they get through the FDA.
Required packaging to be child
Required
resistant.
I wonder if there's
And
is
I
there a
think
date
that
on
was-
there as far as when that.
This article was July 11, 2016.
Yeah, so it's,
yeah. So you still have the products out there, but that was one of my major concerns when they started talking about vaping was accidental poisoning, because it's concentrated nicotine. The other thing that, my concern with vaping is that you don't really even see the device, you have no idea what's in it.
Right.
So there's no way to label, as they're all individual. So, agree, it's hard to enforce, I don't know.
Well, even if you did, the laws that they're talking about to make it square with tobacco would not have any impact on what you just mentioned when it comes to the accidental poisonings. Funny enough, I remember the poisonings from nicotine from the Marcus Welby show years ago when the kid was chewing on cigarette butts, yeah.
Yeah.
But I came across, well, I'm old. I came across something this weekend that actually surprised me. You know, we always talk about having things for youth to do and stuff like that, and looking at skate parks. My son does this Pokemon Go thing, and I'm driving him around, see, you know, something to do together. So we have a vaping thing in Belfair, and I was really surprised at what I saw. And I'm not judging, I'm still trying to digest it. You've seen a spa or steam spa, and you see what the windows look like. Coming through there, we're 10:30, 11 o'clock at night, the place had 50 people in there. And the windows were steamed up like it was a spa, and they were coming in and out, and I'm going, what the heck? Looking at this, it was so odd and different. Somehow, it has become an event. And that's what they're doing on weekends. I don't know, I didn't hear music or not, but the place was loaded with people. And some of them were pretty young. I was thinking to myself, I know it's a little prudish when I say it, but I couldn't help but just think, here I am with my son trying to do something with him, and I see this is where all the other teenagers were, and I thought to myself, I didn't even know that was happening.
Wonder if they were meeting fire code for occupancy.
Yeah, probably not. There was a lot of people in there, but more than that, I never thought of them coming together as a group
They're
to
called
vape.
vaping lounges.
Is that what it is? Except for, I'm not sure this is a lounge.
Oh, a lounge.
Yeah.
A room.
I'll go by, I figured I'd go by and I'll look at it again in the daylight and go in and say hi as a business and just look at it. But I was taken back. I was a little bit surprised.
So maybe at this time we can just put everything on hold and see if there is any for future.
Also, as a recommendation otherwise.
I don't know, I'm gonna go look at this, and to be honest with you, I don't like the idea of putting new laws on things,
Yeah,
that's just not
but-
what but if these are all a bunch of 13-year-old kids that are going
Yeah,
into this.
well, they should
That-
be there.
Violated.
Yeah.
Yeah,
So I
they
guess my
shouldn't be
question
there.
is,
Yeah,
on the
18.
on the enforcement, is it the Liquor and Cannabis Board that is required to enforce the underage sales and things like that?
Oh, which sign?
I think that's
My
who we
son's
fall
there.
to. Same as tobacco.
Right,
No,
same
I'm
as
going
tobacco.
Yeah, I
Yeah,
think
who
vaping
recognizes
is gonna fall
I mean,
under
question.
the tobacco laws at some
Right.
point soon.
Right.
Soup around.
Like, when I see a bunch of
Okay,
kids.
so
coached
maybe
up
if
all your
there's
kids.
no other thing with that, we'll move on to Mason Matters update. Jeannie, you're up.
Okay. You want me to stand or?
You can come up here. You can come up here. Don't be afraid.
I'm not afraid.
We won't
I'm
bite.
sick, I don't want to get you guys sick, so.
Oh, stay away from me. Yeah, 1%.
Gets to see me again tomorrow. 3 feet next day. Okay, so thank you for having me. Mason Matters has been going 100 miles an hour for 3 or 4 months now, I feel like, and trying to spread myself everywhere to get to know people in the 7 priority areas. I've focused a lot on the BHO, or the Behavioral Health Organization, and I submitted an application for the advisory committee, and it has been approved by our county commissioners and by the advisory committee for the BHO, and now it goes forward to their governing board. And part of that is an RFP for a mobile crisis team that will be in Mason County, and they'll be filling in some of the gap between law enforcement and treatment for people that are having overdose or mental health issues. And so right now I'm reviewing 2 applications for the BHO, along with, I know Casey Salisbury is also reviewing and scoring them. So that will be coming along, and I don't know when it'll be up and running, but would guess by the beginning of the year. So
November is the target.
November,
We have to
well,
go back out on the RFP.
right, because they only had one at first. So I've been attending those meetings and getting to know people and learning more about what is available and who is doing the work. So those have been very valuable. I've been going to the Housing Coalition work group meetings, and they're using collective impact and don't know it. And one of the things that I think we've decided is in our campaign for moving Mason forward, we really aren't going to use that kind of language, because it's more, health department language and not real people on the street language. Say, oh, we're going to do collective impact. So we're going to gather a group of people interested in awareness. We're going to start with awareness, because that's the first step in change, and we're going to get the campaign going and out there this fall and moving Mason forward and what it means and what our priorities are. Start getting people to jump on board, and then the data is a huge piece, and we are going to be trying to get the groups and organizations doing the work aligned so that their data can feed into Collective Impact Insight Vision and be published on our websites and their websites, and people have access to better data that's maybe a little more timely. And as a piece of that is a Robert Wood Johnson Foundation funding opportunity, and it's called Evidence for Action. And Justin Smith from WSU Extension is right now putting together a letter of intent for it. And it's about new ways to collect data and be able to use it real time rather than waiting a year lag. So he will be talking about that, I think, a little bit at the Mason Matters meeting. So Mason Matters is transitioning their board, developing a really great manual for people that are interested in coming on to the board. We have several openings. There'll be an application and a handbook that will give them an idea of what the Community Health Improvement Plan is, what our plan is, and what our role in the community is, along with the hospital and the health department and the other partners that we work with. So I think I have a 4-page update just for the last month of what I've been doing, but I really have enjoyed the position, and I'm just ready for feedback from anyone that will want to let me know if I'm going off in the wrong direction. But I'm kind of what's rising to the top, and
Lydia and Debbie have been really great and helpful, and Terry of guiding me of who to talk to. I did have someone from Molina Health, from their home health group that works here in Mason County, that reached out to me, and I met with her, and she's interested in being on this awareness group, and she's got some other people that she works with that maybe too. So just from an article in the newspaper.
Yeah.
So I think what Jeannie needs and what the Board of Mason Matters would like is some very thoughtful requests regarding what do we want Mason Matters to be doing or reporting to us and all that. You know, she's looking for some direction. So at some point, if there is something that you'd like from Mason, for Jeannie to present to this group, each meeting or as needed and all those things, she needs that kind of direction.
Because I think I'm ready. I've spread myself everywhere, now I need to focus certain areas and what you need from me.
As a board, not me.
You. The community, really.
Yes, the community, and I think that it's mainly what we were trying to focus on was the 7 different items. It was 6 and then we got 7.
Mhm.
Those are the community health improvement plan 7 focus areas.
Yes.
That's what you're referring to.
Yes,
Yep, those priorities.
okay,
The 7th was substance abuse,
such,
which was,
right,
and mental health,
Right.
which were, substance abuse had been put into all, and that didn't really
Right, work.
It needed its own
So,
focus, which
it
it's a
sounds
huge
like
focus
it's a
right now in
real
the community.
focus right
Yeah,
now, and
so
I
it's
think
good.
that's what we're
Yeah.
focusing on right now.
Well,
So,
there's the need and
Yeah.
people are paying attention to it.
yes,
So.
too many deaths. Okay, so that's a great update.
Okay.
And I guess we're down to foundational public health.
Okay, Foundational Public Health, latest and greatest. I did include in your packets some of the pieces we've been working on that are really in-depth reports. Read at your leisure, or if you need some sleep.
Just quick, were these packets on the, you sent them
Yes.
over? What, it needs to be sent, it's gotta be sent PDF on mine.
Okay,
Yes, so if you could resend that, I would appreciate it.
and do that.
Yes, my computer has security issues.
Okay.
Thank you.
A lot of this is very technical. It just gives you an idea of what has gone on really for the past 3 years. So let me bring you up to date on what's going on right now. Tomorrow, I'm with the Secretary of Health and the Deputy Director of Operations for Snohomish County, speaking to a joint special committee on health at the legislature, and we're going to be talking about foundational public health. The Secretary's going to be talking about foundational public health in broad terms. So if you have all these things that public health can do, what are the things that public health must do as that smaller subset? And if those are the things that we must do, they must be available in every county, how do we fund those things? You know, what is the mechanism by which that work goes forward? Is it driven from top down, very centralized, is it very decentralized? And how do we find which pieces of that fall where along the spectrum? We'll also be talking about shared services, and that's and that could be anything. In the past, I've used shared services. So, for example, we would share an epidemiologist amongst several health jurisdictions rather than a single health jurisdiction having to foot the bill for an epidemiologist. They tend to be very expensive, and really they can cover a number of jurisdictions. There are places where, as local health jurisdictions, we would do agreements between ourselves. In the past, I've worked with Okanagan, and I pay for half of an HIV person, they pay for half of an HIV person. Between the two of us, we got the work done. That's kind of the shared kind of services that we're talking about.
Health officers.
Health officers shared out, another great example where jurisdictions share those resources. So looking at those in a systematic way, and to figure out how do we save money and still provide service. Because funding is always going to be an issue. I do not see funding turning around anytime in the near future. My piece of the presentation tomorrow, and I've talked with Commissioner Jeffries about it, is I'm representing small rural health jurisdictions. What does that look like for the foundational piece? And my point is that in many cases, we have to quit saying we're doing pretty well with the funding we have and start saying we're failing at some of these things because of the funding we have. There are some things that we are just not getting done to standard. And some of those things may be tobacco. For example, tobacco was funded from cigarette taxes up until 2009, at which time the legislature swept those funds into the general fund and left most of the small counties with no tobacco program. We've had the same thing happen with the HIV program. Now, that was a little bit different in that the state looked at HIV based on disease load. So smaller counties may not have as much disease, and in this case it would be HIV, and pulled those funds and sent them to places that had a higher disease load, which makes sense. But in doing so, we lose track of who in our communities has HIV. We have no way to do case management. We just don't know because the funds went elsewhere. Obesity, diabetes, those are some of those things that are not funded, that are known problems in our communities, and that really are foundational. So my point to the legislature is going to be, we have a problem here, and saying that we're doing okay, it does not cut it. Because it's really not the truth on what's on the ground. We have to be careful on some of these things. There's a danger of regionalizing things to the point where only the major metropolitan areas have services and they just don't get done in the rural communities. We want to make sure that those services are offered and available in all of our small rural communities. We had quite the debate yesterday. That leads me right into yesterday's conversation, is the Allocation Funding Committee, which I've been a part of since it started. And yesterday in Kent, we had a day-long debate with the health jurisdictions. We had two large health jurisdictions, Seattle and Clark, and we had myself and Lewis County, and Spokane was there as kind of a mid to large size health jurisdiction. And then DOH, talking about if we have funding come to us, how do we make sure the decision-making process on how that's distributed is transparent? Because in the past, it seemed very arbitrary and capricious. We just didn't know how DOH allocated funds. It was a mystery. And then if funding comes to local health jurisdictions, how do we make sure it's allocated in a way that addresses all the counties? And that may vary by disease load. Say, for example, we have a pretty good handle on one thing, and we don't here in Mason County have that as an issue, but somebody else does. Like a very high tuberculosis rate, for example. We have counties that have a high immigrant population that have high tuberculosis rates. Other counties don't. So, how do you adjust those variables? How do you look at the equity amongst the counties? And some of the things we talked about were: do you do a base for every county, and then a multiplying factor for, say, disease load, and then per capita? And that seemed to be probably the most palatable solution. Because if we use tobacco as an example, tobacco work should be able to be done in every county. There should be somebody there doing that work. So we should have a base that covers that. In places where smoking is a really high issue, problem, maybe have an adjustment factor, and then have a per capita basis that takes into account those large populations. Yeah, talk to you.
I wanted to, having a base is very important because that is the capacity issue. We may not have a high burden of tuberculosis in this county, but don't tell me that in the last 2 months. We've been inundated by rule out tuberculosis and actual TB cases, which, we get one every 3 years. But they can all occur 1 year and then you don't see anybody for the next 3 or 4 years. So, but we still do have to have the capacity to handle those kinds of things. The same thing with tobacco, the same thing with HIV. When you talk about a county like Mason County, we still need that very basic amount of funding to be able to do some work around it, because part of what we're doing is preventing the cases. You can't prevent it when they already have it. But in this county, we can prevent it because we
And if
don't
you're
have that
successful,
many
you should.
cases.
Mhm.
You get-
And
Yeah.
so
Yeah.
we're almost being penalized for doing a good job of doing the prevention, or we completely ignore the prevention until we have cases, and then by then, it becomes a little late to kind of try to catch it once the horse is out of the barn, or whatever you say. You know,
Mhm.
once we've been hit, then you're dealing with exposures as opposed to actually doing the 1 ounce of prevention type of piece. So, yeah, I really believe in the need for having baseline funding that is available to all, even with regional and some shared services. There's some services that make sense to regionalize and some that do not.
And that's the big part of the debate, so.
Yes.
So if you build an algorithm that has those things, what are those variables that you're gonna plug into that to get your end result? So the work group has tasked me to start working on that piece of it. If you have a list of these, this long of variables, maybe not all those variables should be included in the algorithm, but pick out the ones that are most common, most frequently addressed: disease load.
Have they
population.
talked about a baseline?
Yes.
So is that
baseline
definitely in
is
the mix, or
definitely
just
in the mix.
controversial?
No, it's definitely in the mix. When we surveyed all the administrators this last spring, that was one of the top priorities, especially amongst the small and rural, is you have to have a base.
Yeah.
Well, with DOH, it's kind of outside of their question. If the money's already coming to the local health jurisdictions, and it's up to us to decide how it's distributed, DOH needs to kind of take a backseat and let WSALFO and the local health jurisdictions take that money and decide how it's going to be allocated in order to address those problems that we know because we live here. We're on the ground.
One of the things that I don't know if this is part of your discussion, but I'd be very interested to see if you've had any presentation on it, is if there is an assumption that our current expense revenue sources would there be a certain percentage of our current expense revenue sources that should be going towards public health? As people are probably aware, I've been in that department, it is very grant dependent. And frankly, our current expense goes to pay back the county for things. So I would be very interested to hear what any kind of policy discussion where of the $1.45 per thousand we get in property tax. Is there assumption that there's a certain percentage that would be directed towards public health?
Okay, so this is kind of the steering committee's view on that was developed over the last 3 years. And this was a lot of debate over a lot of months. And the way the steering committee finally came down on it was that the foundational pieces should be paid for by the state. So if it's a state requirement to do these things, the state should pony up the funds for it. Then if you take
Outside of the local property tax.
outside of local, so we're not talking county contributions at all, we're talking state funding. Then those services which you would consider to be additional important services. So in the case of Northeast Tri, our additional important services that were big, and it's community, the community says this is important for us to do, was WIC and family planning. So for additional important services that aren't foundational per se, that's where county local dollars would support. It would be those additional things particular to that community. So it would be a reallocation of how county funds, so it's not coming to support foundational, but it would come to support those additional important services. This makes the presumption that the legislature is going to go for it and would be willing to fund that to the tune of ballpark $350 million.
Which next to McCleary is a bargain.
Yes. So it's another thing for the legislature to consider, and that's part of the work that's being done tomorrow, is to lay that groundwork, to start talking those issues. So when we get into the legislative session, that we can have a framework that's already been discussed and start working details. And get a sense for the legislature's priorities and address their biggest concerns up front.
Okay.
And that's what I have on that.
So I guess we're down to replacement of Frank Phillips on the Board of Health.
Does anybody have the history of Frank's appointment? He
I don't.
represented Frank
Fire
Phillips
dis-
represented the fire district commissioners.
Right.
So all the elected commissioners for all the various fire districts in the community, in the county, he represented them with the idea that I'm thinking
That he
that
brought
he
back.
represented the constituency, not necessarily on fire issues, but he would be representing the constituency because he's an elected person, and he talks to that constituency.
Right.
Apparently, So I don't know if that's in bylaws. Does anybody know if that's in bylaws, or if that is in any kind of code regarding having fire district? Do we have enough history with?
I don't think there was any code. I believe when we expanded, when the board was expanded by the previous commission, that, and Tim might remember, that they wanted to include fire as part of the community electeds. So I don't know that it came from a code at all.
No.
I think it was a decision
It was just
made of who the makeup of the
Right.
board would be.
Because one could also, I know there's a fire commissioner association, which probably made that more easy, or easier than saying a school board member
Right.
would be appropriate. Because I don't think there's an association of school board members.
No, and I think it's
No, and-
because the fire has.
Actually, there is.
It's more.
There is.
Yeah.
Here in the county, that meets on a regular basis.
The county for school board members, they have an association just like we have our county association.
Okay, but
Yeah,
there's
but
there's a
not-
local fire commissioner association. I'm wondering if there's a local school board.
Not that, no.
But I think it also has to do with the fact that, you know, people
Right,
respond.
EMS, right.
Oh,
It's
okay.
health.
EMS for health.
He can, the ambulance drivers kind of know what's going on health-wise in our community. So I think that was part of it. And so,
In some other communities that I've worked with, we met in Wenatchee this last spring to talk about EMS and public health. And one of the things that came to mind is there are a lot of ways in which EMS could be part of the public health involvement. For example, they know who their frequent flyers are and why they're coming to the hospital, what those conditions are out in the community that we may not see because they're not reportable conditions. We don't know that people are having falls, those sorts of things, but they're public health issues, but there's no way to report it by that. And that's kind of a piece that they could bring to the table.
You just mentioned half an hour ago a name of a gentleman that was one of the,
Hoffman.
who?
Dr. Hoffman?
Dr. Hoffman, right, he's the physician that runs the ER.
Can we get him? Oh, he runs the ER, I thought you were saying he
But
was for EMS.
he's not
He's not
really an
elected.
elected official,
Actually, I do have a name. There is a
but don't we want an
District 6.
elected,
There's a District 6 member.
do we
Well-
want an elected official?
That's how it was set up with the boards, yeah.
Yeah. So that was one reason why it was that, but,
Except for these days, the hospital district is no longer represented by an elected official.
yeah, and she has no voting,
Good point.
But we did just empower these people to be a voting member on the Board of Health, so we want to be able to continue that.
yeah. So is with the EMS council, those are not voted in, they're not voted by the public, so I guess that's something we have to consider.
was I don't know whether it was a resolution or just what, that went along with adding the extra ex officio members to the Board of Health. So we'll have to dig that out of the archives and see what it says.
So maybe this is something that we should table till next time and have some more.
I think we need to see what the authorizing documentation says.
Yeah.
To make sure we're doing this
Yeah.
correctly, and if we need to
We could, yeah,
revise it, then we need.
exactly, exactly. So I guess that's tabled for now. Any other board discussion?
Apologies, I honestly, you guys never need me for a quorum, so I stayed with some people that was asking me questions. I didn't think nothing about it, to be honest with you. And then I get the call that they actually need me for a quorum. I felt really bad. My apologies.
Well, that's
Won't
part
happen like
of
that again.
Frank not being here.
I realize that, but I was thinking about that while we were talking about it.
Well, I want to take this opportunity, I probably said this to a lot of folks individually and in other settings where we're all together. The Behavioral Health Organization, the Thurston Mason Behavioral Health Organization is submitting a grant application to fund the development of psychiatric beds here in Mason County.
Yes.
And then hope to have, if the funding is still available, to come back next year and apply for funding for a detoxification facility. And so we're very hopeful it'll be very competitive, and I think almost every behavioral health organization in the state is applying for this little bit, $7 million that's available. As Jeannie had shared about the mobile crisis response team, we were very fortunate to finally get at least 2 responders to their request for proposal. We were very hopeful to have had this up and running by August 1, but we had to go back out and so at least see some more proposals, and we got 2. And thank you, Jeannie, and to those who responded to the request to review the proposals. But that is, I think, a huge answer to a lot of what Dr. Yu talked about, and a lot of issues that we have here for inappropriate incarceration of people due to no other way to give them the kind of help they need. And then finally, I just wanted to make the announcement that there's a triage, psychiatric and substance abuse disorder triage unit that will be opening up in Thurston County and I think next week. And there is a ribbon cutting and all that. But what it'll also provide is a involuntary hold facility for law enforcement, more beds for law enforcement to bring people who are involuntarily being held. We have a very huge shortage of beds, in case anybody is aware of that. Huge shortage of beds in this
How many
area.
beds are in that facility?
That one will add, I think 20 beds.
And they said September 1st, it'll open.
Okay, so
Where is that
there's a
located?
ribbon cutting.
Where's
I
that?
honestly don't know. I have got an address and I went looking for when they come.
Yeah, they were real brave.
I'm hoping I can be there for the ribbon cutting.
They're trying to hide it.
And then, in case anybody else that didn't know, there is a private entity that was awarded a certificate of need, which is required in order to open a large psychiatric facility. Anything over, I think, 16 beds. And they were awarded this certificate of need, and that will be built in Lacey. And I think that was going to be about a 45-bed facility. Now, this group, as they were looking for public support for their application for the certificate of need, had made a comment, or had made the promise, and I hope that they stick to it, that they would be willing to come pick up patients and transport them to the facility. As you all know, transportation is always an issue, especially with psychiatric, because if they're being transported by ambulance, they can. I don't know that it's ever happened, but you hear this a lot from emergency responders. They can say, "Stop! I don't want to go," and be let out in the middle of the street. So sometimes it's better to have a mental health professional do the transporting, and this is what we're very, very excited about. Plus, they could be the beds that would be the the backup beds if some of our immediately identified centers like our evaluation treatment center and our triage center in Olympia are filled, which frequently they are. So our access to mental health services is definitely expanding.
Commissioner, thank you for all your work you've been doing on that. 2 questions, is there something that we should be doing to help you to get further along? And on another note, is there, on the people that will be making the decision on the funding, are there any elected officials that we should be lobbying, or I should be?
I appreciate that, yeah. No, this is kind of an agency decision, Department of Commerce, and so there's no lobbying that I think that is possible there. I appreciate the ask about any help. I will definitely let you know. I am continually flabbergasted at the type of support Mason County gets from the Thurston County professionals and commission regarding access to services here in Mason County. I think it's just, it's phenomenal. And if you ever see Commissioner Bud Blake and Commissioner Kathy Wolf, be sure to give them your thanks, because they have been nothing but supportive of us. One of the issues that and the last one, in case people don't know, and Commissioner Netherland is aware of this as well, we do have I think it's called a federally qualified community health center provider.
I was pulling that up because I was going to say.
Go
ahead, I'm so
called
excited.
Peninsula Community Health, who will be
Belfair.
locating and providing
Belfair.
services to
Belfair.
Medicaid eligible patients in Belfair. And this includes folks mental health, primary health, and dental.
Dental.
Yes. 6
Right.
beds.
Right
6
downtown
beds.
Belfair.
Very
excited.
excited.
And so I immediately got them in touch with our behavioral health organization so they can be another contractor for
Right.
services. And
And I
very
think
excited.
they said-
January 2nd.
Yes. They were hoping even before that, but
Hopefully it won't be snowing or something, because people
Yeah.
will really want to get there that day.
so, okay. Any
Madam
other?
Chair, if I might.
Okay.
One thing I wanted to bring the board up to speed with is that public health staff, the building inspector was not able to come out into the field with us, but he was part of the planning team and then the follow-up work. And 2 sheriff's deputies went out to 3 sites a couple weeks ago. They did a nice inspection, diagrams, photos. We have health officers' orders ready to go out. But in a conversation that Barbara and I had, and then we all shared it at our management team meeting today, we talked about the fact that these issues are so much bigger than getting a building permit or taking care of their garbage or their on-site sewage falling out of the trailer onto the ground. That really and truly what we do when we do these things is move them from lot to lot around the county. There's one big group that was out on Johns Prairie Road that has moved a couple of times, and I think we just found them again out on Ben Swinger. But it's like they don't have any place to go. There are mental health issues. There are drug addiction issues. There are poverty issues. So all of this just ties in together, and it ties in together with this enforcement work that we've been doing out in the county. So I just wanted to say, don't forget those folks too, because we're trying.
Yes.
Did we get a final vote on the question about sponsoring the event?
Yes.
Yes.
We did?
Yes,
Yeah, yeah.
and we said yes.
I know the individual is, but I didn't hear the final one. I thought,
Yes.
did we ever get that one?
Yes,
Okay,
it
thank
was a
you.
yay.
We agreed to allow,
Appreciate that.
what's that old thing, if you, I'm there for, if you ever need anybody to help you move or advice, I'm always there for advice.
I want to ask a question. So are you implying that the efforts to maybe get intensive case management
Mhm.
services to, that you might even be identifying folks?
We may be, yes.
Okay.
We have one of the sites that they went to. They only made 3 sites with the sheriff's deputies because they were called to a crime. Went out to a few more, but those were the main 3. It was a little community. There are no services, no building permits, just shacks and RVs drug on. But it had a main road, they had flowers planted along it. One of the photos that the staff took, there were two neighbors out there visiting and probably wondering what the county cars were doing there. It's a whole different thought process in a different world. We had the folks in here talking about poverty and that culture of poverty, which, I had a really hard time dealing with in my own mind. But then we start adding these other things that you've all been talking about this afternoon on top. And we've got some issues, and now we've got some solutions and some hope and some help for these folks.
Okay.
And by doing this in a combined way, it's certainly more efficient. And we're using tools we have not used recently. A health officer order as one. A health officer order has a great deal of authority. We're combining that with some zoning issues and working to do those, but like it gets to be a complicated situation as you go down the road.
But we just need to keep empowering you to keep moving forward. You're finally getting somewhere.
Yes,
Yeah, thank you, Dave. I love the idea of using the health officer or
yes,
listen to-
great.
Well, what's funny is they've been using it for quite a while on the side. Now they actually have an actual head that's going to use it as a real hammer. Because they've been doing it individually, I know, because I end up calling them and they speak out what they could.
When you get complaints from the people,
Yeah.
we do it too.
Yeah.
Okay, anything else?
One last thing is Dr. Yu has been reappointed for another 3-year term on the Washington State Board of Health. So our own Dr. Yu is up there serving.
accept?
She must have.
Yeah.
Aha!
So
Her
that's very-
retirement just got pushed out.
So that's what she was
It's,
talking about.
Dr. Yu is recognized across the state as probably one of the finest health officers in the state. And it's good to see her on the State Board of Health.
Well, Commissioner, remember those emails we used to get? We can throw those away. I didn't know that. That's pretty cool.
Yeah, that is cool. Okay,
Don't
shall we
forget to sign the
adjourn?
minutes before you leave. I'm trying to move that we adjourn.
We do really have to have a blue pen for those?
No.
Okay. That's the city issue. Don't sign anything without a blue pen.
So you can't tell us that
Copy.
copy?
Yeah.
Okay, so, did I hear a second?
Second.
Okay, all those in favor? Yay.
Aye. Yay.
And
I want it.
we're just supposed to go.